Reviewing the concept of iCARE. Nursing action items. Compassion. Nursing actions are critical approaches implemented to transform the nature of care delivery in a given facility or setting. Kelly and Lefton identify compassion as a powerful attribute that guides professionals to sympathize with different patients and seek appropriate strategies to meet their demands. The best action that resonates with this value is the importance of assessing the expectations of all individuals. Such a model will make it possible for practitioners to collaborate and pursue superior ways to solve emerging conflicts. They will go further to identify superior practices to develop a new culture that resonates with the aims of the team. They will assess and monitor the changing expectations of different children in the unit. The team members will collaborate with their parents or guardians to deliver high-quality health outcomes. Advocacy. This concept encourages caregivers, nurse aides, nurses, and physicians to focus on their patients' demands and fight for their rights and health goals. The most appropriate nursing action plan is engaging in advocacy work to ensure that those in leadership positions identify and introduce superior policies that can empower such individuals. The approach will empower more practitioners and clinicians to work together more than ever before, thereby contributing to interprofessional team support. This achievement will trigger a new culture that focuses on shared values and aims. They will collaborate, solve differences, and eventually find new ways to deliver personalized care to the targeted patients. The level of patient outcomes will improve significantly. Consequently, more people will be willing to seek personalized or high-quality medical services from this unit. Resilience. Resilience remains a powerful quality or attribute that nurses should possess. This value makes it easier for them to be prepared for emerging challenges and make informed decisions to address them. The best nursing action item for this component is constant problem solving. Since conflicts, personal differences, and challenges will emerge throughout the care delivery process, practitioners will need to address emerging issues and eventually support the formation of cohesive interprofessional teams. The challenge will become a new opportunity to work together and establish a new culture in the unit whereby all participants will be willing to focus on the welfare of each other. They will also respect and treat all stakeholders fairly and in a professional manner. These actions will make it easier for all nurses and clinicians to identify and implement new ways to improve patient outcomes. The established care delivery model will eventually meet the changing health needs of the targeted children. Evidence-based practice. This concept has attracted the attention of many stakeholders in the fields of nursing and marketing. It revolves around the identification of emerging insights and applying them in practice. The best action plan that will contribute to interprofessional team support is that of continuous learning. Those involved will acquire emerging ideas and concepts that can eventually transform the nature of care delivery. The members of the teams will be able to revolutionize the services available to more patients in the pediatric unit. A positive culture of introducing emerging evidence in the field of nursing will become a reality, thereby making it easier for the unit to become a preferred source of timely and high-quality pediatric services. This goal is possible since more nurses and clinicians will embrace the component to identify and introduce emerging models and care delivery theories that have been tried and tested. Consequently, the established teams will become a source of inspiration for all and eventually maximize patients' outcomes in the selected unit. Concluding summary. The above discussion has supported iCARE as one of the best models for supporting interprofessional teams. The major components guide all members to collaborate, remain resilient, advocate for the needs of the patients, and introduce evidence-based concepts to maximize the quality of available medical services. I can influence this process by applying my leadership skills to ensure that more practitioners, nurse aides, and caregivers are willing to work together and deliver personalized services. I can go further to introduce the concept of cultural competence to guide all teammates to respect each other and focus on the ultimate experience or medical outcomes of every patient.